My name is Chelsea. I'm here to do a head-to-toe assessment on you. Is that okay?
Yes.
Okay, the doctor has ordered this. I do have a student here with me. This is Tim, and he's here and he's going to be learning from me. So I might be interacting with him throughout the procedure or the assessment. Is that okay?
Okay.
Perfect. So first thing I'm going to do is I'm going to start with your skin. Okay. So Tim, when we're looking at the skin, we're looking anteriorly and posteriorly. Um, we're looking for scars, nevus, lesions, bruises, and also the color. And so we're looking here at Miss Thomas and checking to make sure that the color is normal for ethnicity. And just for upon inspection, I don't see any obvious scars or wounds. Do you?
I do not.
Okay, perfect. And so next thing we're going to do is palpate the skin. And so when we do that, we're checking the upper and lower extremities and everywhere for temperature, turgor, texture, moisture, and edema. So first thing we're going to do is check for temperature. And when we do that, we're going to check with the back of our hands, and we're going to check the open skin areas. And we're feeling warmth, which is normal. We don't want to feel any coolness. We also noticed that the skin was normal texture. Didn't notice any excessive dryness or excessive moisture as well. Next, we're going to check for skin turgor. So when we do that, Tim, we usually check over the clavicle, okay? So we just take a little piece of skin, pinch it, and what we're doing is checking for tinting. So we didn't see any signs of tinting, which means you're adequately hydrated, which is awesome. So what we're going to do next is then check for edema. So what we do is I'm going to get you to hold your hand out for me, and we're going to check for edema. So we're going to look at the hands first, and we do not see any signs of edema. And then do you mind letting me see your foot? And then we're going to check the leg, ankles, and the foot as well for any signs of edema. And Miss Thomas here, I do not see any signs, obvious signs. But if I did, I definitely would dig deeper and check for pitting edema as well. But I do not see any signs at the moment. Okay?
Okay, good.
And then we're going to go to the head. So what we're going to do is we're going to check the hair for color, density, and make sure that it's evenly distributed. So as we're looking, we do not see any balding, we do not see any alopecia or hair thinning. It is a normal color, which is brown as well. And then next we're going to palpate the scalp and the head. Is it okay if I touch you?
Sure.
Okay. So next we're going to palpate the head and check for any scalp tenderness or hair tenderness. Was there any tenderness when I did that?
Not much at all, but
Okay.
yeah.
Perfect. So that is good to know. And then next we're going to move to the nails, okay? So when we look at the nails, we would want to look at both the hands and the feet. Right now we're going to look at the hands, and we're going to check for any redness, swelling, or pain, okay? Do you have any pain right now in your fingernails?
No.
Perfect. Next thing we're going to do is, I don't see any redness or swelling. Do you?
I do not.
And nothing obvious. And while you're doing this, you can also check for cap refill in all 10 fingers, and ideally we would check the toes as well. Was there any pain or tenderness when I pressed on that?
No.
Awesome. So the normal firmness of nails is present as well. So now we're going to move on to the respiratory system. So when we check the respiratory system, we're going to check the front, chest, and then the back here, okay? And when we do that, first we're going to start by assessing our patient. We're just going to look at them and look and see, do we see any signs of respiratory distress, such as use of accessory muscles, tripod positioning, being tachypnic, are they cyanotic, which means are they blue? We're going to check for any nasal flaring, retractions, and see are they breathing symmetrically. So as we're seeing, just looking here at Miss Thomas, she is breathing symmetrically, bilaterally. So next thing we're going to do is I'm going to have you, if you don't mind, do you mind facing this wall a little bit for me so that we can see? So next thing we're going to do when we're checking the posterior back, okay, is we're going to palpate. So first thing we're going to do, ideally, is we want to check for lung expansion. So you would hold right here, and I'm going to get you to take a deep breath for me. Perfect. And we want to check and make sure it was symmetrical. Did you see that?
Mm.
And then next we're going to check for tactile firmness. So I'm going to have the patient say 99 while we're checking over the upper and lower lung fields so that we can check to make sure that there's no unsymmetrical sounds, okay? So go ahead and say 99 for me.
99, 99, 99, 99, 99, 99.
Perfect. And so we didn't feel any abnormalities there. Next thing we're going to do is we're going to percuss over the lung field. So we want to find the intercostal spaces. So you would want to find your intercostal space, your middle finger, and I'm just going to do some quick tapping, okay?
Okay.
So, and you want to make sure to stay away from bony prominences as possible, okay? Perfect. So you want to also listen for mixture of timpani and dullness throughout, okay? Next thing we're going to do is that we're going to auscultate the lung sounds. So that means we're going to listen to them with our stethoscope. So with this, we're going to start above the scapula. And every time you feel my stethoscope, I'm going to get you to take a deep breath, okay?
Okay.
All right, take a deep breath for me. And then you're going to move left to right, and then down, and then right to left, down. And you would continue that motion to listen to the lungs upper and lower on the posterior side, okay? So next what we're going to do is we're going to continue listening and check for bronchophony, egophony, and whispered petriloquy, okay? So while we're listening, I'm going to have the patient, first we're going to check for bronchophony, so I'm going to get you to say 99 again, okay? When you feel my stethoscope on your back. Sound good?
Yes.
All right.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. All right, and so that was normal, and you would hear normal 99 throughout. You wouldn't hear it to be muffled or very loud, okay? Next thing we're going to do is I'm going to get you to say E, okay? And so this is checking for egophony. So when she feels my stethoscope, she's going to say E. And if you hear A, that can be concerning, okay?
E, 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 E.
Perfect. So that's listening for egophony. Next, we're going to listen to whisper petriloquy. So what you would have to do is have the patient whisper 1, 2, 3. If we hear it very loudly, that can be concerning that there's maybe some fluid in the lungs, okay? So when you feel my stethoscope, can you whisper 1, 2, 3 for me?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. And so we didn't hear any over loudness. Everything sounded good there. Okay. So now we're done with the posterior lung sounds. So now we're going to move on to the anterior. So if you don't mind, I'm going to get you to reposition and face this wall for me. And so first thing we're going to do, as always, Tim, we're going to inspect, right? So what we do is we're going to look at the patient and make sure that we see no signs of deformity or asymmetry when this patient is breathing. Right now we don't see anything, which is good. And so next thing I'm going to do is we're going to palpate, okay? So is it okay if I touch you up here? We're going to check for chest expansion and then the tactile fremitus again, okay? So first thing I'm going to have you do is just take a deep breath for me. Awesome. And then now we're going to check for tactile fremitus. So we're going to check throughout the anterior. They're going to say 99. Okay, so when you feel me, just say 99, okay?
99, 99, 99, 99, 99.
Perfect. So we felt normal vibrations, normal fremitus. So nothing concerning there. Do you have any questions so far?
No, ma'am.
Awesome. Perfect. So next thing we're going to do is we are going to percuss over the anterior chest. So I'm going to do that little tapping motion again. So you would definitely want to find the intercostal space, and this is where you're going to tap. Okay, and there was no concerns. It was timpani. throughout and dullness throughout. And then now we're going to listen to the anterior lung sounds, okay? So you would start in your normal position up here. Take a deep breath for me. Perfect. Move over. All right, I'm going to come under here. Awesome. Perfect. And so we definitely want to keep that motion of right to left, down, left to right. And then, of course, that is it for your respiratory assessment. So now we're going to move on to the heart. So when we're assessing the heart, we have to check 5 cardiac landmarks, and we have to know their position and where they're located when you're assessing them, okay? So first, I'm going to, you don't have to breathe or anything, like you can continue breathing normally. So first thing I'm going to check is going to be the aortic, which is going to be the second intercostal space, right sternal border. Then the pulmonic, which is going to be the second intercostal space, left sternal border. Erb's point, which is going to be the third intercostal space, left sternal border. And then we're going to check the tricuspid, which is the fourth intercostal space, left sternal border. And then the mitral, which is going to be the fifth intercostal space, mid-clavicular line. So it lines up with the middle part of the clavicle, okay? Once we find our mitral pulse, we're also going to check for the pulse, point of maximum impulse, inspect and palpate. So I'm going to get you right here, okay, so we can feel that, in which we do. So this is where you're going to check for that point of maximum impulse, okay? Next thing we're going to do is we're going to also, what you would do is auscultate. Once you find that point of maximum impulse, you're going to auscultate for 1 full minute, checking the rate and rhythm. For example, it might be 70 beats per minute and have regular rhythm if that's what you heard. So I'm going to show you where we would check, which is going to be over here in the mitral area. And like I said, you, when you're assessing your patient, want to check for 1 full minute, okay? Noting the beats per minute and the rhythm. So next thing I'm going to do is I'm going to have the patient lie down. So I'm going to get you to scoot back if you don't mind. Okay. And I'm going to get you to lean against your pillows and you can just relax, okay? So ideally, we would want to have the patient, we're checking for jugular vein distension. So when we do this, we're going to check both sides of the neck, checking for jugular vein distension. And when we do this, ideally the head of the bed is going to be 30 to 45 degrees. I'm going to get you to turn your head to the right for me. I'm going to move your hair, okay? And so what we're going to be doing is, if you look over here, you're going to take your pen light and checking for any jugular vein distension or pulsation, okay? And then, do you mind turning your head to the left? And we're going to do the same thing. See if we see any jugular vein distension or pulsation, which we don't, which is good. We don't want that, okay? Then next thing we're going to do is check for heaves and lifts. So what you're going to do is you're going to take your hand over the left sternal edge and check to see if you notice any abnormal movements, which we don't here in Miss Thomas. And then we're going to check for thrills, where we're going to put our hand over each cardiac landmark and see if we feel any vibration, which would be abnormal. So we're going to do the aortic, pulmonic, Erb's point, tricuspid, and mitral, okay? We didn't feel any vibration, which is good. And then once they're lying down, you want to reassess and re-auscultate their the 5 cardiac landmarks again, okay? So I'm going to listen to you your heart one more time, okay? So the aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And then our mitral, which is going to be our fifth intercostal space, mid-clavicular line. And so that concludes your cardiac assessment. Do you have any questions about how to do that?
No, ma'am.
Okay, perfect. So now we're going to move on to your abdomen, okay? And so your abdomen, we're going to be listening and touching your stomach. Is that okay?
Okay.
Perfect. So Tim, what we're going to do is first, as usual, we're going to inspect, okay? So as we're inspecting the abdomen, it's good practice to look for contour and symmetry. So you're going to want to look from 2 angles. So you might want to look from this side and maybe go to the head of the bed and look at the other side. And as we're looking, we're seeing Miss Thomas has a normal flat stomach. We don't see any signs of distension in Miss Thomas, which is what we're looking for, which is good. So next thing you're going to do with the abdomen, you want to make sure to auscultate first because we're looking for bowel sounds, and if you percuss or palpate, it might get those bowel sounds moving, okay? So we're going to listen first. We're going to start in the right lower quadrant, move over clockwise around to the other quadrants, okay? While we're doing this, we want to listen if there's any hypoactive, hyperactive, or normal active bowel sounds, okay? So if you don't mind, I'm going to take a listen. So you'd start in the right lower quadrant, listen for a minute. Right upper quadrant, left upper quadrant, and left lower quadrant. And as I'm listening, I'm assessing this patient has normal active bowel sound, so that's how we would assess that. Next thing we're going to do is we're also going to listen for our abdominal arteries. So we're going to start with the abdominal aorta, which is here in the middle, and we'd be listening for any bruits. So we're going to check for that. We're going to check for the right and left renal arteries, which are above the umbilicus on the right and left side. We're going to check for right and left iliac arteries. And then, of course, we're going to check for right and left femoral arteries, which are closer to the groin area. And there were no signs of bruits for those, which is good. Next thing we're going to do is we're going to percuss the abdomen. So we're going to do that tapping motion again in all 4 quadrants, okay? You want to hear tympany and dullness throughout, depending on which section you're in, okay? Okay, perfect. So next thing we're going to move on to is palpation. So we're just going to press lightly and then deeply in all 4 quadrants. So what I want you to tell me is if you feel any pain or tenderness while I'm pressing down for light or deep palpation. And then you also want to check for masses, Tim, while you're assessing, okay? So first I'm going to start in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Did you feel any pain or tenderness with that?
No.
So you want to assess at each point. So next we're going to do that deep palpation. So I'm going to go a little bit deeper, okay? Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Did you feel any pain or tenderness with that?
No.
Okay, and so while you're palpating for that, you, like I said, want to check for any abnormal masses as well, okay? I didn't feel any masses, which is good. That's normal, and the fact that you don't have pain or tenderness is normal as well.
Okay.
So next thing we're going to do is we're going to assess the liver and the spleen. So as we know, the liver's on the left side. So I'm going to have you take a slight turn towards me.
Okay.
You can hold on to this railing. So what you would do is you would kind of grab from the back here, grab under the rib cage, and I'm going to get you to take a deep breath in and out for me. All right, one more time. Perfect. And so I feel the liver, but it's not enlarged from what I can tell. And now we're going to assess the spleen, which is on the other side. I'm going to get you turned barely. And what you're going to do is grab behind, grab under the rib cage, take a deep breath for me. Perfect. And the spleen was not enlarged, so that's good as well. Last thing we're going to do is we're going to check for CVA tenderness. So, Miss Thomas, if you don't mind, I'm going to have you sit on the edge of the bed again for me.
Sure.
And Tim, when we're checking for CVA tenderness, you're going to check back here on each side. And what you're doing is you're checking to see if they have any tenderness, okay? So I'm just going to make a motion, and you tell me if you notice any tenderness, okay? Okay, did you notice any tenderness?
No.
Perfect. So that's good. That's normal. We want that non-tender. And so that's how you're going to assess that patient for the CVA tenderness. All right, Ms. Thomas, so that concludes our head to toe assessment. Do you have any questions for me today?
No, thank you.
Perfect. Tim, do you have any questions about what we did today?
Thank you
No, ma'am.
both.
Okay, perfect. Awesome. Well, I appreciate it. So everything's within reach if you need it. If you would like to get back to bed, you can. Your call light is within reach. I'm going to put the bed rail up. And of course, you can always give us a call if you need us. Everything seemed great on my end, but of course the doctor's going to be in to examine you shortly, okay?
Thank you.
Okay,
Thank you both.
All right. Have a good day.
Thank you.